There are many possible causes for pain above the left hip. In some cases, the pain may be caused by a condition or injury affecting an entirely different part of your body. These causes range from mild injuries that heal quickly with rest to aggressive illnesses that require immediate medical treatment. To determine the source of the pain above your left hip, it's usually necessary to take a look at your other symptoms. Doing so can make it easier to know if you should see a doctor. Here are the possible causes, their symptoms, how they're diagnosed, and your treatment options. Pain above left hip causes. Less serious causes female-only causes, male-only causes arthritis, bone cancer, ectopic pregnancy, prostate cancer, bursitis, hernia, endometriosis, celiac disease, ileocecal abscess, menstrual pain, Crohn's disease, ilium fracture, ovarian cyst, diverticulitis, kidney stones, pelvic inflammatory disease, PID, muscle strain, side stitch, left-sided appendicitis, osteomyelitis, leukemia, pinched nerve, pancreatic cancer, polymyalgia rheumatica, sacroiliac joint dysfunction. Less serious causes and symptoms. A few of the less serious causes of pain above the left hip will resolve on their own without treatment. However, many conditions require medical attention. Arthritis. Arthritis is a condition that causes swelling, stiffness, and sometimes severe pain in one or more of the body's joints. There are several types of arthritis that can cause pain above the left hip. Possible causes of arthritis include normal wear and tear or age-related breakdown of bone in the body. In some cases, arthritis is caused by disease. Arthritis symptoms you may experience include redness, reduced range of motion, stiffness, swelling. Bursitis. Bursitis causes inflammation of small fluid-filled sacs, called bursa, that pad your bones, including those in your hip. Most cases of bursitis in the hip are caused by repetitive motions or positions that irritate a joint's bursa, such as running. Other bursitis symptoms include ache, shortness, stiffness, swelling. Celiac disease. Celiac disease is caused by an allergic reaction to eating gluten that affects the small intestine, causing pain and discomfort in the abdomen. Gluten is a protein found in wheat, barley, and rye. Doctors aren't certain exactly what causes celiac disease, but some risk factors include Addison's disease, family history of celiac disease or dermatitis herpetiformis, autoimmune thyroid disease, Down syndrome or Turner syndrome, microscopic colitis. Other common symptoms of celiac disease include abdominal pain, anemia, blooding, constipation, diarrhea, fatigue, itchy skin and rashes, nausea, nervous system problems, weight loss, vomiting. Crohn's disease. Crohn's disease causes inflammation of the digestive tract, causing pain in the abdomen. Doctors don't know the exact cause, but the following factors may put some people at risk of Crohn's disease: autoimmune issues, being around age 30, smoking cigarettes, a family history of Crohn's disease, being of Northern European or Anglo-Saxon descent, being of Jewish European descent, also called Ashkenazi Jewish descent, living in an urban environment, nonsteroidal anti-inflammatory, NSAID, medications. Other symptoms of Crohn's disease include abdominal cramps, bile duct and liver inflammation, blood and stool, delayed growth and sexual development, in children diarrhea, eye, skin, and joint inflammation, fatigue, fever, fistula, myxoris, reduced appetite, weight loss. Diverticulitis. Diverticulitis is a condition causing inflammation or infection of the small pouches, called diverticula, that line the digestive system. This often causes pain in the left side of the abdomen. Diverticulitis occurs when these pouches tear. Causes of diverticulitis include advanced age, lack of exercise, obesity, poor, low-fiber diet, smoking, some medications, such as steroids. Other symptoms of diverticulitis include constipation, diarrhea, fever, nausea, tender abdomen, vomiting, muscle strain or stitch. Muscle strains are a severe pulling or overextension of a muscle. If a strain occurs on the left side of the body, it may cause pain above the left hip. Soak and side stitches, a common and temporary athletic injury. Causes of muscle strains and stitches include poor form during sports activities, repetitive movements such as running. Other symptoms of a muscle strain or stitch include bruising, limited motion, muscle spasms, muscle weakness, pain when breathing, redness, swelling. Pinched nerve. A pinched nerve in the lower back occurs when a nerve becomes compressed by surrounding body tissues, often causing pain near the hip and in the legs. Common causes of a pinched nerve include arthritis, herniated disc injury, obesity, repetitive motions, sciatica. Pinched nerve symptoms may also include burning sensation, feeling your foot has fallen asleep, muscle weakness, numbness, tingling or pins and needles sensation. Polymyalgia rheumatica. Polymyalgia rheumatica is an inflammatory condition that causes muscle pain and stiffness, which often worsens in the mornings. Causes aren't clear but are likely to include advanced age, environmental factors, genetic history of polymyalgia rheumatica. Other symptoms of polymyalgia rheumatica include depression, fatigue, mild fever, limited range of motion, loss of appetite, weight loss, sacroiliac joint dysfunction and sacroiliitis. The sacroiliac joints are found where your lower spine and pelvis meet, near the hips. Sacroiliac joint dysfunction occurs when there is flawed movement in at least one of the sacroiliac joints. Causes of sacroiliac joint dysfunction include arthritis, infection, pregnancy, traumatic injury. Symptoms may be worsened by bearing extra weight on one leg, climbing stairs, running, standing for long periods, taking long strides when walking or running. Sacroiliitis is the inflammation of the sacroiliac joint. This can cause pain along the buttocks, hip, lower back, and sometimes down the leg. Serious causes and symptoms. Osteomyelitis. Osteomyelitis is a bone infection that can occur when bacteria enters a bone inside the body. Common causes of bone infection include infection through the bloodstream, injuries such as puncture wounds, unsterile surgery. Besides pain in the affected bone, symptoms of a bone infection include fatigue, feveredness, swelling, and warmth at the infection site. Bone cancer, or unusual growth in the bone, is often benign. However, in some cases the growth can become aggressive and spread to other parts of the body. This can cause pain and a palpable hard mass in the bones. There are different types of bone cancer, all of which can be painful. Genetics, disease, and radiation therapy for other cancers may be risk factors for bone cancer. Additional symptoms of bone cancer include fatigue, swelling, unintended weight loss, weakened bones that fracture easily. Hernia and inguinal hernia is a condition caused by the protrusion of part of the intestine through a weak spot in the abdominal muscles. This can cause a lot of pain. Causes include chronic sneezing or coughing, increased abdominal pressure, intense activity, pregnancy, strain during bowel movements or during urination, weak spots in the abdominal wall. Iliopsoas abscess. Iliopsoas abscess is a very uncommon but serious condition causing an infected mass to form along the upper part of the hip bone, ilium. Other symptoms may include fever, pain in the groin, visual deformity on the hip. The most common cause of iliopsoas abscess is Crohn's disease. Other causes include HIV and AIDS, diabetes, intravenous drug abuse, kidney failure, suppressed immune system. Ilium fracture. An ilium fracture is a break in the large upper part of the hip bone. Fractures may be mild, moderate, or severe. Symptoms may include fatigue, feveredness, and swelling at the fracture site. Causes include advanced age, physical stress that is repetitive, such as long-distance running, trauma, such as a fall or car accident, weakened bones, such as an osteoporosis. Kidney stones. Kidney stones are hard mineral deposits that form in the kidneys, located at the backside of your body above your hips. Kidney stones may cause the following symptoms: excessive urination, nausea, painful urination, persistent urge to urinate, radiating pain in the lower abdomen and groin, smelly or cloudy urine, urine that is pink, red, or brown urine that comes out in small amounts. Vomiting. Causes include special diets, especially those high in protein, salt, and sugar, dehydration, digestive issues, family history, obesity, other medical conditions. Left-sided appendicitis. Appendicitis causes sudden painful inflammation of the appendix, which can be deadly if untreated. The appendix is located on the right side of the abdomen, but in very rare cases, it can cause pain on the left side. Other symptoms include bloating in the abdomen, constipation, diarrhea, fever that worsens over time, flatulence, loss of appetite, nausea, pain worsened by movement, or coughing, vomiting. Appendicitis is caused by a blockage in the appendix lining that causes infection. Leukemia. Leukemia is cancer of the body's blood-forming tissues, which can cause pain in the bones. Other symptoms may include bruises or bleeding that occurs easily, kills enlarged liver or spleen, fever, frequent infections, nosebleeds or spots on the skin called petechiae, sweating, especially at night, swollen lymph nodes, unintentional weight loss, weakness. There are several types of leukemia. Doctors think leukemia is caused by mutations in blood cells in the body. Pancreatic cancer. Pancreatic cancer is cancer of the organ that lies behind the bottom of your stomach, the pancreas. If left untreated, pancreatic tumors can cause hip pain. Other symptoms include blood clots, depression, diabetes that's newly developed, fatigue, loss of appetite, unintentional weight loss, yellowed skin and eyes, jaundice. Doctors aren't sure what causes pancreatic cancer, but it appears smoking can increase your risk of the disease. Female-only causes and symptoms. There are some causes of pain above the left hip that can only affect females. These include ectopic pregnancy. Ectopic pregnancy happens when a fertilized egg attaches itself to the outside of the uterus instead of the inside. This condition can lead to an emergency if left untreated. Besides intense abdominal and side pain, symptoms include early pregnancy symptoms, slight vaginal bleeding that worsens over time. Positive pregnancy test. Risk factors of ectopic pregnancy include getting pregnant while using an intrauterine device, IUD, having a damaged fallopian tube, having a sexually transmitted infection, having had a previous ectopic pregnancy, having undergone fertility treatments, smoking. Endometriosis. Endometriosis is a painful condition causing the lining of the uterus to grow outside rather than inside the uterus. It can affect the ovaries, fallopian tubes, pelvic tissue, and other organs in the pelvis. Other signs of endometriosis include bloating, constipation, diarrhea, excessive bleeding during or between periods, infertility, nausea, pain during sexual intercourse, pain during urination or bowel movements, painful periods, dysmenorrhea. Clear cause of endometriosis isn't known, but risk factors include atypical reproductive tract, female relatives with endometriosis going through menopause, late, having short menstrual cycles, less than 27 days, heavy period, high levels of estrogen in the body, low body mass index, not giving birth, starting menstruation at a young age, menstrual pain, dysmenorrhea, affects many women who menstruate, sometimes causing widespread abdominal pain. Other signs include cramping or throbbing sensation, dizziness, dull ache, headache, loose stools, and diarrhea. Pain that hits 1 to 3 days before your period and stops in 2 to 3 days. Menstrual cramps are triggered by hormonal changes associated with menstruation. However, some conditions affecting the female reproductive tract, including endometriosis, may worsen menstrual pain. Ovarian cyst. Ovarian cysts are sacs filled with fluid that may grow on a woman's ovaries and cause pain in the abdomen. In most cases, these cysts are harmless and may not even cause symptoms. However, some women experience pain as well as aches, bloating, heaviness in the abdomen. You may be at risk of developing an ovarian cyst if you have endometriosis, hormonal issues, pelvic infection, pregnancy, previous ovarian cysts, pelvic inflammatory disease. Pelvic inflammatory disease is a serious infection affecting the female reproductive system. Often it causes no symptoms at first, but if untreated it can cause severe abdominal pain. Other possible symptoms include abnormal bleeding between cycles or after sex, fever with chills, heavy and unpleasant smelling vaginal discharge, pain and bleeding during sex, painful urination, or problems urinating. Male-only causes and symptoms. There is one cause of pain above the left hip that can only affect men. Prostate cancer. Prostate cancer is a growth that affects the prostate gland, which produces sperm. Some cases of prostate cancer are slow-growing and cause few symptoms. Others are more painful, serious, and aggressive. Some symptoms include blood in semen, bone pain, difficult urination, erectile dysfunction, lowered urine stream. The cause of prostate cancer is unknown. However, some risk factors include advanced age, being of African descent, family history, obesity. How to diagnose pain above the left hip. To diagnose the cause of pain above your left hip, a doctor will start by asking you about your symptoms and medical history. They will also perform a physical exam, looking closely at your left hip area. They may run tests to better determine the cause of your pain. Blood, joint fluid, and urine tests. Testing the body's fluids can reveal abnormalities that indicate disease in the blood, bones, and urinary tract. Endoscopy. An endoscopy involves sending a long camera tube down a person's throat to look inside the small intestine. This can reveal signs of infection or digestive disorders. Imaging tests. CT scans, ultrasounds, MRIs, and X-rays can reveal cancers, cysts, deformities, and bone fractures. Depending on what the doctor finds, they may refer you to a specialist who can better diagnose and treat the cause of your pain above your left hip. These specialists may include gastroenterologist, specializes in digestive health, obstetrician gynecologist, specializes in women's health, oncologist, cancer doctor, orthopedist, specializes in bone health, urologist, specializes in male reproductive and urinary tract health. Treatment for pain above left hip. The kind of treatment you need for the pain above your left hip depends on the cause. Treatment may include antibiotics to clear infections such as diverticulitis and PI, chemotherapy and radiation to treat cancer, lifestyle changes such as a change in diet, quitting smoking, and increased exercise to treat conditions like Crohn's disease, and side stitches, medications like NSAIDs to reduce symptoms of dysmenorrhea for mild causes of pain above the left hip, such as muscle strains, and side stitch surgery to treat certain cancers, remove cysts or the appendix, and repair fractures. Takeaway: in some cases, pain above the left hip is a major cause for concern. However, in most cases, it can be treated easily with rest or an over-the-counter NSAID. Most causes of pain above the left hip are not immediate emergencies and are easily treatable. Paying attention to all of your symptoms can help lead you and your doctor to a treatment that will resolve your pain.